Right, so today we're going to talk about adjustments. So I often get asked by patients what adjustments actually are, what they do, what the noise is. So I thought it would be a good idea to make a video just explaining all of those things really. So firstly, what is an adjustment? So an adjustment is a technique, a treatment technique used by chiropractors, osteopaths and some physiotherapists to try and get more movement out of stiff areas in the spine. The noise that's produced, so the cracking noise, it's the same as when you crack your knuckles, which I can't do at the moment, but the cracking noise itself is just a bubble of gas forming during the adjustment and then imploding in on itself at the end of the adjustment. The cracking noise is in no way related to the beneficial effects of the adjustment and is in no way related to the bone clicking back into place or anything like that. The crack doesn't need to happen to still get the beneficial effect of the adjustment. So that's a really important thing to remember, and sometimes adjustments cause the cracking, sometimes adjustments don't cause any cracking, but the adjustment can still be very effective even without the cracking noise itself. I often get asked, are adjustments safe? And yes, they're very safe. For the average patient with low back pain, there's more side effects and more risks from taking ibuprofen or paracetamol than there are from having an adjustment of the low back. So the treatment itself is very safe. A certain percentage of patients will experience some muscular soreness after the treatment, but the soreness is similar to the soreness you would get after a big workout or a long period of exercise. You'd probably expect to feel a bit sore and a bit stiff afterwards, but kind of the day later you should wake up feeling even better. And most patients after the treatment, after the adjustment, have an instant reduction of pain and they leave the treatment room feeling a lot better already. Another question I get asked quite often is, how do adjustments actually work? And to answer this question, we have to answer with a bit of an easy cop-out first, because we don't fully understand how adjustments work. The research that's been done on the topic so far is quite inconclusive as to exactly how it works, although we do have some good theories as to how the adjustment produces the beneficial effects. So the beneficial effects of the adjustment are numerous, but the biggest benefits is in decreased pain, improved movement and mobility, and decreased muscle tension as well. So to understand these three improvements, we first need to know a little bit more about why the area becomes painful in the first place. So for someone with low back pain, their muscles and joints in their low back will be sending lots of signals to the brain, and the brain perceives the signals as pain. So the brain perceives it as a painful low back. With the adjustment, we help to improve the movement of the joint, which helps to send different signals to the brain. And because the brain is receiving a different kind of signal, it starts to concentrate more on the new movement signal and starts to reduce the amount of pain being experienced from the low back. So although we do the adjustment to the low back, a lot of the positive changes occur in the brain, and the brain then sends signals down to the low back to allow decreased pain to be felt, to allow improved movement to be had, and to also help to relax the muscles and reduce the muscle guarding that happens whenever a joint in the back is injured or is stiff as well.